A disaster is a human-made or natural event that causes destruction and devastation that cannot be alleviated without assistance. So that's basically what a disaster is. And there are different types of disasters. We have internal disasters, those that are located or occur within a healthcare agency, and we have external disasters that occurs outside the healthcare agencies. And disasters can be many things. It could be a fire, it could be a hurricane, it could be a tornado, it could be a lot of things. The most important thing to know for you, for the NCLEX, is how does the nurse respond whenever we have a mass casualty event or a disaster. Why is this important for you? I have seen many nurses making huge mistakes when answering disaster planning style of questions, or when they are prioritizing mass casualty event style questions, because the priority order changes a little bit. And we will discuss those questions today. In a disaster, triage consists of a brief assessment. The nurse has to conduct a brief assessment in order to identify what is going on with the patient. You have to identify the severity of the injury. What type of treatment does the patient require, and what you as a nurse, what is your priority nursing action in order to help those patients in need. But what is the problem when there is a mass casualty? What is the problem with triage when there is a disaster? The problem is that you could have 100, 200 patients in one time, coming everybody towards you, and you don't have all the time in the world to do your usual head-to-toe assessment. You have to do something more simple, something that is faster. A type of triage that is used in disasters or mass casualty event is known as the simple triage and rapid treatment start. Basically, this is a strategy that it is used to evaluate the severity of injuries to each victim and find a solution quickly. Now, the important key factor of this type of triage is that it needs to be done within 30 or 60 seconds. So in 1 minute, the triage needs to be done, and you have to do something to start helping these victims. Now, what is a keynote, a key factor to prioritize whenever there is a disaster or a mass casualty event? The priority is survivability. It's not only who is the most unstable patient, but you need to identify what patient is unstable but has a higher chance of survival. That is the key when you're answering prioritization style questions that deals with disaster or mass casualty event. So I will show you an excellent strategy that I have developed that could help you understand and can help you answer these types of questions. The strategy is this one. I want you to take a photo of it, write it down, because you need to learn this strategy in order to answer these type of questions. This simple strategy has 3 steps. Step number 1, you're going to review the NCLEX question. You're going to see that the question deals with a disaster or a mass casualty event. Once you have determined that you are indeed facing a mass casualty event, a disaster event, you have determined that, and the question deals with triage, what patient you will be seeing first, you have to ask these three questions. Number one, which victim sustained injuries that are life-threatening? That is an important key factor. Question number two, which victim sustained injuries that are non-life-threatening? And question number three, which victim can survive? Which victim has a higher chance of survival? Once you have determined this, what is going to be your next step? So if you're reading a scenario where you have victims that sustain life-threatening injuries and you have other victims that sustained non-life-threatening injuries, it is very common to understand that you will be eliminating the patients that sustained non-life-threatening injuries. So, first step, you will identify who has life-threatening injuries and who doesn't. Step number two, you eliminate any patients that has non-life-threatening injuries. And then you are going to keep only the patients that have life-threatening injuries. But you see, there is nothing new that you probably already know from understanding prioritization. But this is the key or the turning point. In step number three, you have to ask, which patient has the highest chance of survival? So, what will be your priority answer? Which patient will be your priority in a mass casualty event, in a disaster event where you have multiple victims? Your priority patient will be the one that has a life-threatening condition but has a high chance of survival. That will be the correct answer.